Okay. Um, well, why don't we get started? My name is Larry Garber. I'm a board member on the United for Dignity Alliance, and it's my pleasure to welcome everyone to this webinar. Let me start by saying Ramadan Kareem to those who are observing Ramadan this month, and particularly to welcome our panelists who have been in Gaza and have been fasting there. And we really appreciate your taking the time to share with us your perspectives. Um, the goal of this webinar is to update folks on the situation in Gaza, including developments since the establishment of the National Committee for the Administration of Gaza and the first meeting that took place last week in Washington of the Board of Peace, and just what impacts that's having on Gaza specifically. We'll also discuss the impact of various interventions by international and Palestinian NGOs on the situation in Gaza, particularly in the health sector, but also more broadly. And last, we'll discuss the potential consequences of the March 1st deadline, which is now only 2 days away, for that requires international NGOs to register with the Israeli authorities, and what happens for those organizations that have been denied registration, and what that impact is on the ground in Gaza for the delivery of services. We're very fortunate today to have two Palestinian medical professionals who will serve as our panelists and guides. First, Dr. Musallam Abukhalil is the founder and CEO of the Gaza Cancer and Chronic Care Network, which merged with various partners to create the United for Dignity Alliance in December 2025. He's a Palestinian physician and humanitarian leader with extensive experience in internal medicine, emergency response, and health system coordination in conflict settings. He served as the health technical lead for Project Hope in Gaza, overseeing medical strategy and health services across primary care clinics and emergency medical teams. In 2024, he launched a humanitarian initiative providing care to more than 100,000 displaced people and continues to shape its mission and operations. He now also works a couple of days a week at Nasser Hospital in Khan Yunis, and we'll be talking about some of his impressions from there. Dr. Amani Salah Alsattari is a general practitioner and the program manager for UFDA's Haven Maternal and Newborn Health Program in Gaza. She graduated also from the Islamic University of Gaza and has been working on the front line throughout the current crisis, supporting mothers and newborns at Nasser Medical Complex and across various displacement camps. She brings both strong clinical experience and humanitarian leadership, having worked with organizations including UK Med and Heal Palestine. On a daily basis, she coordinates doctors and midwives and leads community outreach to make sure women continue to receive safe and dignified care. The format for today is that I'll start by asking both Musallam and Amani a series of questions. At about halfway through, 11:35, 11:40, we will open the floor for questions from the audience. Please raise your virtual hand or place your question in the chat. We will then unmute you and we will call on you, and you will be able to ask your question live to Dr. Abukhalil and Dr. Salah. And just so that everyone knows, we're recording today's session and we'll make it available on the UFDA website for those who were not able to join today. I should say a number of folks that I invited are attending a rally to mark the 1-year anniversary of the demise of the U.S. Agency for International Development that's taking place downtown. And so some folks particularly asked me if we could share the recording because they're going to this rally. So let me start with you, Musallam. and ask you a few questions just to get us up to date on the situation in Gaza. And so, can you provide us an update on just what's happening on the ground? Uh, Particularly, we're now in the Ramadan month. Is there food available for people to purchase? What type of iftars are taking place after the fast? Just give us a sense of what life is like in Gaza, and maybe specifically where you are in Nusrat, the town of Nusrat.
Thank you, Larry, and thank you everyone for being here. Truly, very quickly, for those who don't know, UFDA, United for Dignity Alliance, is a Gaza-led and internationally supported. We are non-political. We do emergency relief. We try to keep critical health care going. We are trying to also make investments in the early recovery civilian systems in Gaza, because you cannot separate survival from recovery. Now, people ask us all the time, is food in the market? And the answer is really complicated. What we are seeing right now is that there is more on the shelves of markets than before. But for many families, especially those who are living in displacement camps, and those count in the hundreds of thousands of people, those items are not really accessible because cash is the missing ingredient. Some of the reporting we have that has come out of Gaza is that the markets really function with more goods visible, but at prices that some of the people are cannot afford. And this is really happening in an environment with continued extreme poverty and economic collapse. And for that, the humanitarian food is doing the heavy lifting. It's the major. It's almost always, for some of those families in displacement camps, the only source for their daily supplies and needs. For example, the UN OCHA really described that there is around 1.75 million hot meals being provided every day and delivered to those families. And but at the same time, the reporting also warns that the ration sizes of those deliveries have been reduced, and the stocks that they already have are still insufficient, even at that reduced distribution. Some of the families that we have been providing support with tell us here in Nusayrat and also in Mawasi Khan Yunis, where the majority of our daily operations are focused, they told us that they always try to find a new organization to fill up their need for the next week. And for some of them, this means that they will have to go constantly to community kitchens, waiting in line to be delivered one meal that could not be sufficient for a family of five or six or seven. On iftars, the people are absolutely trying to keep the spirit of Ramadan, which we have used to live before October the 7th. And they're doing this with the new ways. They're doing this with, as I mentioned, community kitchens. They are sometimes doing this with shared meals between the families living next to each other in the displacement camps. Sometimes they try to do this, but this is very much scaled down than previously seen in the last, especially with Ramadans before the war. And it's really because everything is fragile and everything is almost dependent on aid distribution and the local improvisation. So this is not something that families are. Yes, Ramadan is always better with no active war happening around you, but you still affordability and accessibility and consistency in the flow of assistance to your family is something that really makes Ramadan very, very difficult for hundreds of thousands of family in Gaza.
So let me ask you, Muslim, as a follow-up, what is the actual security situation in Gaza? Do people feel safe on the streets? Are you able to travel, for example, from your home uh, to the hospital in Khan Yunis without fear? And how visible are the Hamas security or police forces on the streets in the various towns?
Yeah, so people have been always talking in the last week about the phase 2 of the ceasefire. After the ceasefire, and for us in Gaza, the phase 2 is really a checklist, and the phase 2 really requires at least three things to be true at the same time. First thing, the people in Gaza really need to be able to move and work without gambling with their lives every day. Yes, there is a formal ceasefire taking place, but there is also scattered or occasional gunfires and airstrikes, the last of which happened in the last 10 days when security checkpoints in the south have been targeted. And So even though there is a ceasefire framework, we're still seeing this airstrikes and gunfire, and many have been accidentally injured and killed during this time frame, and also including against medical and humanitarian sites. The ceasefire really did not translate for us into safe streets. Um, and the second thing that must take place in this phase 2 is that we need the predictable access. So the aid is really coming in, but the kitchens are really operating at a very huge scale. And that's really great. But the missions that has to be deployed into Gaza still get denied. They are still being delayed, and sometimes the rations that family receive really get cut. And when that's happening, the families in these displacement camps really feel it immediately. And the third thing that must happen during this phase 2, and this really ties to the security situation and the safety, is that there must be a real civilian authority has to be able to work and operate across in Gaza. And they have to be working or operating inside Gaza with a clear mandate. They have to operate there with a clear budget and with a clear security cover. Yes, the U.S. has been telling us, telling the world that they have that the phase 2 has been announced, and the technocratic committee and international stabilization force will be taken over. But there is a huge gap between what's being announced and what's being implemented. And as you all, many of you know, the National Committee for Gaza, for the administration of Gaza, is still waiting in Cairo, and they have not been able to come into Gaza to rebuild and to restart the construction in Gaza. Now, regarding the uh, s- uh, the security situation in Gaza, there is visible policing and there is law and order efforts in some areas, but this is only, as we have seen, in the form of several checkpoints that is being struck, and this is why this is really important. The politics of the security arrangement in Gaza is still unresolved, and and there is some reports that the National Committee is recruiting for a new police force in Gaza, and they are trying to plan up the scale up, but there is this conflict around that there is existing police and civil servants within the existing Palestinian government in Gaza, and this means that the core that really provides security is still unresolved. So there is this tension between the two, actual facts on the ground. Now everybody of us wants security, and but the conflict or the dispute here is really about the sequencing. who disarms and when, and the underwater protections, and what guarantees that the civilians really don't pay the price between those period of a transition, just like we did when we have a complete security collapse during the active wars, days of the war, when the humanitarian trucks were looted, when homes were stolen, and where people do not feel safe to leave their houses to pick up things from the market. So we don't want this to be happening again because of the security gap that is I think, going to take place during this transitional period.
So let me ask you one other question, then I'm going to turn to Amani. We've heard a lot about the Israeli denial of registration for various international NGOs, including Doctors Without Borders, which we know, Medicine Sans Frontières, which we know, has a major role to play in the health sector, including at Nasser Hospital. We also heard a couple weeks ago that MSF had announced that it was stopping certain non-critical medical procedures because of their concerns about, Hamas or other armed folks in the hospital area. You work down there. I'm curious as to your impressions, both of what is going on at the hospital, but also, what has been the impact of the MSF announcement.
Yeah, honestly, as I work in the Nasser Medical Complex in Khan Yunis, and what we have seen on their news website is that their public rationale is that there was safety, there was staff and patient safety after an alleged serious security incident taking place inside the hospital. Um, and this is something, and they made that decision to scale down their non-essential services. But this decision is not just something to do with one organization. MSF, Doctors Without Borders, is actually responsible for many of the critical orthopedic surgeries and services inside inside Nasser Hospital, including rehabilitation services and outpatient clinics, which many direct casualties of this war depend on, especially in an area where you don't only have the population of Khan Yunis crowded and stranded together in one place, but you also have the population of Rafah, which is now completely inaccessible to those families. So this is Nasser Medical Complex, in which MSF has provided significant support to, is now feeling the burnt of this, decision. In terms of the impact we have seen, when a major medical actor like MSF really scales down their operations in an area which I described as the major hub of medical services in the south, even if only partially, the pressure really shifts in onto everyone else who is also been strangled. For example, MSF is not the only organization which has been banned from continuing operation in Gaza for international staff and the entry of essential supplies. But there is also another 36 or 37 of them. So you can imagine the intense, enormous healthcare burden that is falling onto other, sometimes small, very effective, but smaller providers or partners here in Gaza. So this is going to be a huge blow to the already collapsing healthcare system in Gaza. And as of today, MSF has published a very brief video about their international staff who is now deployed in Gaza, who have been asked to leave Gaza by tomorrow. And beginning March the 1st, none of those organizations will be allowing the entry of international staff who have been working hand in hand with the already outstretched medical providers in Nasser Medical Complex, but also in other hospitals.
Great. So let me turn to you, Amani, and maybe just to narrow down and focus specifically on situation of women in Gaza with whom you work, mothers, young teenagers, and what are their concerns today? What are they most concerned about when it comes to whether it's health issues or broader social issues?
Okay, thank you all for being here and taking the time to listen. Some people ask me what women are most worried about right now in Gaza. The most important thing for them is stability. I hear questions like, will the war come back before my baby even grows up? And will the crossings stay open or will they close again? Can I go back home? If they close, will the prices go crazy again? Essential items like milk, diapers, and everything. Will I be able to raise my kids without consistent worry for food and supplies? And will life ever feel normal? Like we can go out, breathe, and get to feel life again like we used to. And under those equations, a bigger feeling that the feeling that women are tired of uncertainty. um, so, from a health perspective, the pregnancy right now is happening inside a crisis. There are still tens of thousands of pregnant women across Gaza, and births are happening every day. So, we are also seeing the impact of hunger, stress on mothers, malnutrition on newborns, and the new among pregnant and breastfeeding women has been a major concern. And the partners screening women have found a really alarming levels of malnutrition. And the question for them is not only the safe delivery, they are asking if they can safely deliver and keep their baby safe after. And another very big issue is the information gap. A lot of women genuinely tells us no one explained this to us before, just they never had the chance to ask, and no one sat with them long enough. And I think this isn't only about pregnancy. It's too many things that with basic female dignity, and it's like period health, like hygiene, like privacy, safety. Menstrual hygiene has been a real crisis for women and girls because supplies and water and privacy all are disrupted in these days.
So can you describe a little bit of money about how different organizations are responding to this crisis, this ongoing crisis? What are some of the activities that you observe that you're involved in, to help out in this respect?
What we see on the ground is that everyone is trying their best, but the need is still bigger than the response. So hospitals are working, but hospitals are also stretched. Our health system has been repeatedly damaged, as you know, and so when you hear a services like services exist that mean this they exist, but yes, but they are fragile. So staff are exhausted, essential supplies come and go, and the caseload is very heavy on the team and on the hospital staff. The international partners like UNFPA, WHO, and UNICEF are supporting on specific ways. They are supporting maternal health services and supporting with dignity kits, nutrition screening, protection, gender-based violence services. But here's the honest part. It's true that ceasefire period created a little more room to work. Things are still very fragile and they can reverse quickly. And a big piece people sometimes underestimate is protection. Gender-based violence rises, especially with overcrowding, displacement, and loss of privacy and economic stress. It's happening every day. So we have this combination of medical needs, protection needs, and mental health needs all at the same time.
So let me ask you the same question I asked Musalam about the impact of these organizations that were denied registration and that are supposed to somehow close down their operations as of March 1st.
Yeah.
What do you see in terms of the specific area where you work in terms of maternal health and reproductive health? What will be the impact of the decision for these organizations to have to leave?
Yeah, so let me answer that in two parts, inside Nasser Medical Complex and outside Nasser Medical Complex. Inside Nasser, in past 2 months alone, based on our team's internal caseload tracking, we have seen close to 1,000 women come through the obstetric department, emergencies and deliveries and surgeries like cesarean sections and postpartum complications and the consultation and family planning cases and visits. We focus a lot on early recognition. So we are trying to catch warning signs before they become disasters. And sometimes the most important thing we do is not clinical. It's giving her space to talk and to be talked to. So now, outside Nasser Medical Complex, this is where I really wanted to emphasize the community work because the hospital can be far. Transportation, as you know, is very hard, and there often isn't time for long conversations, educations, and reassurance because the teams on the hospital are busy with emergencies and always the next emergency is already coming. So we go into the camps and communities and we talk in a simple language about the things women actually ask about. We talk about gender-based violence because it increased during the war and it doesn't disappear after the war. So women need safe spaces and they need to know what support exists. We talk about pregnancy, what's normal, what's dangerous, and when you should seek help immediately. We talk about the menstrual period and menstrual health, about its not small because it's been extremely hard to manage with this shortage and this limited wash access. Um, we talk about hygiene using what's realistically available, and no one needs perfect advice, but it doesn't matter, doesn't match their reality. And honestly, I think half of the value is just listening to women. Women stay after sessions and they tell us we need more of this. And many say that this is the first time someone explained it clearly to us. And a lot of women aren't only asking for information. It's simple what they are asking for. They are asking for reassurance and want someone to answer their questions without a judgmental or without the rushing ways.
And I mean, I take it this is part of your vision for a future work within UFDA in terms of reproductive health initiative, or do you want to
Yeah.
add anything to where you'd like to see this initiative go within the work of the new organization?
Yeah. I want us to move from the emergency response only mood, something stable and consistent. That means two things happening at the same time. Inside hospitals, we want to support equality, great mentorship, and better follow-up, respect for maternity care, and strong coordination. As well as in communities, we need regular education and support for women. We want to do this so women understand their bodies. Women should know danger signs, and they know their options, and by they can feel less lonely. And I want maternal health to be treated like a part of maternal health, not the mental health. I think um, should be not an extra to programs. It must be integrated to a maternal health program. If recovery is real, women should feel it in the most basic places: safe delivery and honest answers, being treated with dignity. That's what we are trying to build here in Gaza.
Great. So I want to open it up to invite others to ask questions of Musalem and Amani. As I said, if you can raise your virtual hand, that would be great, and I'll call on you. We'll unmute you, and you can ask questions. I'll ask one more question while people are getting ready to raise their hands. For Musalem, just if you can talk a little bit about the situation vis-a-vis the what we call the de facto authorities in Gaza. Do they impose any restrictions on your ability to operate as an NGO? Um, what are the sensitivities of working in Gaza today, the political sensitivities of working in Gaza today as it affects your operations? And like I said, if you can raise your hands right after this question, we'll start taking questions from the audience. Go ahead.
Yeah. Yeah, in terms of implementing humanitarian or developmental activities in Gaza, there are so many political sensitivities that and constraints, and actually constraints around humanitarian operations right now. It's not only coming from one political entity; it's coming from everybody. From within the Gaza Strip, there are certain administrative requirements for to coordinate the delivery of assistance into different geographies of the Gaza Strip, and 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 this is one part of the equation. The second part of the equation is that there is also this new requirement of having Israeli registration for some of the for all INGO, international non-governmental organizations, to be able to legally operate within Palestinian territories, not only in Gaza but also in the West Bank, and also about the potential closure or ban pressure that is coming out of those requirements if of those certain organizations do not comply. Now, with the de facto authorities in Gaza, there is as there is this, as I mentioned before, the coordination and the administrative and the regulatory framework that all organization has to comply with. For example, for health activities in Gaza, the Ministry of Health, the government-run Ministry of Health, does organize the service mapping of those new primary care centers or field hospitals that will be set up for the Ministry of Social Affairs. Any food distribution or aid distribution that is going to take place must also be coordinated with them. This is how far we have seen in terms of the administrative interference in NGO work. We don't know if this is something that is applicable across all other larger organizations or not. But I think in the coming few weeks, when the National Committee for the Administration of Gaza, there will be more robust and consistent practice around, coordinating the activities, the multi-sectorial activities of the NGO sector in Gaza.
Great. So I'm going to turn now to the audience. See a question by Howard Sumka. So Howard, if you could unmute and ask your question, that would be great. And direct it to either Musalam or Amani, or both.
Okay, thanks. This is, I think, for Musalam, and it sort of follows on the question you just asked and Musalam's answer. I'm curious, Musalam, how you distinguish the security forces, how you know who's out on the street, who is not Hamas, and when you say the civil police, who controls the civil police? Who is the de facto local authority for that? And how much interference is there in your daily life, at least, from the clans that were competing to take some control in different parts of the Strip? Thank you.
Thank you so much, Howard, for your question. For the normal average Palestinian civilian who is living in Gaza, the understanding that they have around who is a civil security police force that is just regulating or organizing the movement and the secure and safe movement of supplies and people from across different areas of the Gaza Strip, you can identify them by them having like security checkpoints that is scattered around the Gaza Strip. They have a civilian vest that they identify with, and uh, so those armed Palestinian force at the is what we see as Palestinians helping with the safety and the security of those operations in Gaza. Now, if we like it or not, there is also this certain fact that most of those low rank and file police forces are only coming for this for the simple purposes is that they want to have an income, and they do not either identify or against or with a certain political identity. So that's very important to have that distinction in place. And now for us, we don't have that kind of questions. It's for political leaders to resolve and to worry about. What we worry about as Palestinians in Gaza is that we want to have security. We want to have people be able to move and things to to move without any trouble. Now, the second part of your question about this, the kind of interference that in our daily activities or daily life as Palestinians, for me personally, I haven't seen any interference of that kind. But this is really dependent on the kind of work that you do. For example, some of the commercial or traders across the Gaza Strip are sometimes asked to provide certain fees or certain taxes. And this is unfortunately one of the hard administrative realities in Gaza. For example, to pay for the civil servants inside the Ministry of Health or other ministries, you will need cash. So this is, I think, perhaps one important, really, I don't want to call it justification, but one use of that money that is being taken from the traders. This is not in any way or shape or form a political like opinion or political analysis of what's happening in Gaza, because believe me, Howard, when I say that none of that is really relevant to many of us, because we just want to have stability, security, and restoration of normal life in Gaza and the rebuilding and reconstruction work in Gaza.
Thank you. George Goss.
Hi there, can you hear me?
Yes, coming through loud and clear.
Thank you so much for both of your time. This question is for both of you, but I wanted to ask about the presence of American mercenaries in Gaza currently, and specifically UG Solutions, which have been putting American ex-soldiers at the kitchens and at food distribution centers. I wanted to ask how it is that they're received and how it is that their general presence is currently. Thank you.
Thank you, George. Now, for the last time we've heard about the deployment of American military, private military contractors inside Gaza was when the Gaza Humanitarian Foundation was able to set up two major distribution hubs, one in central Gaza and one at least in Rafah, to help with this distribution. And this has been publicly known and talked about within the civilian circles in Gaza. I haven't heard or seen or have someone told me about the existence of other American forces within the Gaza Strip. I haven't. Also, um, the thing is, there will be never be a chance where those foreign military forces will be accepted and accommodated within the Gaza Strip. I think it's going to be a bad decision to have international foreign forces within the Gaza Strip to help with the security. Perhaps they could do something similar to help with the mentoring and coaching the Palestinian security forces, but not like an independent presence within the Gaza Strip. It's not going to be accepted in any way with the communities in Gaza.
Amani, do you want to add anything on that?
No, thank you.
Okay, so let me ask a question and I invite others to raise their hand, but there's a question that came in from someone online before the session that I'll start with you, Amani, and then Musalam, you can comment too. It's from Nashat Taher. In the context of ceasefire stage 2, what does the current epidemiological picture in Gaza reveal about acute and injury-related conditions, and how does medicine availability or the lack thereof impact continuity of care and the transition from emergency response to sustained recovery? So again, more what is the current state that you're dealing with, and what are the available medicines that you can use to respond?
Okay. 1 second.
Yeah, I think okay. I'll make my comment really quickly before Amani answers it. The lack of essential supplies in Gaza, including some essential medicines for patients who require chronic maintenance treatment, like patients with cancer and chronic disease, are being affected the most since they depend on a regular delivery of their medications. And this is really the moment where a patient whose chronic condition is stabilized and followed up adequately is now having a preventable complications like having a stroke, an hypertensive or patient with hypertension, increased blood pressure, who is now not able to access their medications, will now have a stroke because and then knock off complications like bed sores and inability to perform their daily activities without assistance. You effectively destroy someone's life, someone at the age of 50 or 4 or 60 who should who should have perhaps an additional 10 or 20 or 30 years of their lives, are now being paralyzed and with complicated medical conditions because a simple essential medications was not available at some point in life. And I have seen this first hand when I saw patients coming to the hospital and we admit them. The majority of cases that we admit at perhaps it's not an overstatement to say that the absolute majority of them do have one or more chronic disease as part of the as part of the reason why their history, medical history, is complicated, and part of that is can be attributed to them not having easy and accessible medical care because they have to travel some distance before they can get one. And the other reason is the medicines that they regularly take not uh, is not
طبعا.
available. So this is a big issue in terms of the health logistics. If I can, if something that really can fix everything, almost many things in Gaza in terms of health protection and other emergency and recovery sectors, it's the logistics sides of things. The logistics, if logistics somehow become consistent and facilitated, and there is no unnecessary delays or political impediments to deliveries, then a lot of this can be fixed in a week.
Amani?
Yeah, and I will add to Musallam that honestly there's a gap now, and the biggest gap is the continuity and the reassurance. And it's not that nothing exists. Some services exist, but some support exists. But women do not feel confident it will still be there next month. So that they'll reach in time, and hospitals are stretched now. That means a human part of care like education, counseling, reassurance gets squeezed. Even so, it's very essential. So bridging hospital care with consistent community-based education, as we see in our program, is one of the biggest gap we are trying to close now.
Um, without anyone raising their hand, let me just ask another question for both of you, maybe. Again, we've heard about the pressures on UNRWA, and I'm just curious if you could talk a little bit about. I mean, UNRWA still provides, I think, services for large segments of the population. 1,200 employees in Gaza. What are you seeing? What are you hearing in terms of their ability to continue providing those services? And what are the concerns that you have of if they are forced to reduce their capabilities?
Yeah, in terms of the situation with UNRWA, the practical, the most perhaps important change that UNRWA has faced during the past 2 years is that the Israeli no contact or cut off environment that they have made on UNRWA, and it makes them it makes things a lot difficult for them. So the coordination becomes harder for them. The staffing and the scaling becomes really hard. And on just stepping back, UNRWA, as many of you know, is really a huge part of the civilian backbone in Gaza. It has been here for a very long time. They have the staff, they have the human resources, the infrastructure, the physical spaces to be able to coordinate and implement massive scale assistance. You would expect and you would see mm, mm, um, different points of service and schools that can be turned into distribution points across Nusayrat and middle area and southern Gaza and northern Gaza that people can get to with no trouble. And this is some advantage that UNO has built up for the past, um, you know, d- d- uh, 3 decades of their existence, at least in Gaza. And you cannot be able to replace that in an instant because of some political, some new political reality. Um, it's very important to know that UNRWA is not just a service provider. They are a huge part of the civilian structure or service here. And when you turn them down, or you try to cut off their operations in terms of logistics and the entry of their staff into Gaza, this means that it makes everybody's job really harder when the backbone is constrained. And just as as quick numbers, there are at least 100, I think 11,000 personnel for UNRWA who are now staff, and there have been some reduction and the number of hours that or the number of days that they can be paid for. There are also some massive or mass layoffs of staff in other branches, like in Jordan, for example. The last one was with security department has been laid off by UNRWA, and the people, the Palestinian families or staff who have been forced to leave Gaza during the active war of the days of the war, are now have been terminated. Their contracts have been terminated, and they now have no longer have livelihood or a source to depend, an income source to depend on when they're in another country with no support system. And I think in the coming few weeks or months, the pressure will heat up and will increase on UNRWA, and this will translate into more families in Gaza and also in other areas who will not be helped, and also staff members who just want to do a great job at providing social services or health services or education services are now going to worry constantly about their future. 11,000 people will worry about their future. Add that to many youth who have not had one single time in their lives to have employment. You can see how this is going to be really hard for everybody, even if he was with UNRWA or not.
So coming to the end of the program, let me ask Musalam maybe to try and end on a more positive note in terms of the vision that you have for a couple of the aspects of the UFDA program. Specifically, I'll talk about, or I ask you to talk about the telemedicine program. Where would you like to see that go? And what needs is it filling, and what do you need to make it happen?
Yes, I think we need to, as the logo we are using and the embodiment of values and that we do, is that we want to be able to build dignity-based support or systems, civilian systems in Gaza, to power up the relief, the care, and recovery for displacement people, for the displaced Palestinians in Gaza. We want to be able to build up our capacity and to design and implement and manage our programs by ourselves as Palestinians who have been through this. So communities affected, we want to be able to empower our communities who are deeply and harshly affected by this war to be the ones who will lead their relief and recovery efforts. That's a very important principle in our work. We also want to be able to get the support of international partners or sponsors who believe that Gaza's recovery is part of everybody's stability and security in the region. It's also answering to everybody's interest, because everybody is interested in a stable, um, even though that's very difficult to achieve, but a stable and safe region. Um, and what do we actually want to be able to do in the future? We want people to understand that they have to fund and sponsor and support things that are actually useful. Things that people will be not only be recovered or relieved by having, but also will be feel a self of their identity manifested in those activities. For example, for the some of the community learning sites we operate in Nusayrat, in Khan Yunis, the staff who are operating this, and we have about 200 to 300 children who are now receiving education from people they identify as their neighbors in displacement camps. So this will be something that will contribute to their sense of normalcy and empowerment. Across all of our programs, and you can read about this on our website, we want to be able to help with this specific patient groups, Gaza's most forgotten cancer and chronic disease patients who need to be consulted with specialist advice that they don't usually have in Gaza because of the shortage of physicians, and also the medication coordination and follow up. We want to be also helping our children with restoring their education and providing them spaces with in which they can play and feel normal again. We want to also provide mental health not just as a separate service, but as an integrated service across all our programs, and the same thing applies for for women and newborns. So I think the basic summary is that we want to be supported by international partners and donors in order to allow the civilian system to be set up in Gaza, in which the communities really help themselves by in their recovery and relief.
Great. So in the good news category, Tom Warwick has posted in the chat that the Israeli Supreme Court issued today a ruling that will allow the NGOs to continue working, at least for the time being, the international NGOs. I haven't read the whole article. I'm not sure if Tom has, but at least it's good news, in the immediate term. And Amani, I'm going to ask you, although Karen Torgman didn't pose this as a question, I'm going to frame it as a question and give you a chance to comment. She says, I'm an Israeli MD and I'm amazed at the serene tone of Musallam and Amani. I would shout and shriek if I were them. And so maybe if you could just comment on, just how do you maintain, this, very positive and serene outlook, given all the horrors that you're describing around you.
Oh, thank you, Karen, for saying that. I really appreciate it. But honestly, it's not that we don't feel like shouting sometimes. We are human, and I was working on the emergency department at the war for 2 years. We get exhausted, overwhelming, angry, and heartbroken, all of it. But when you work in this environment every single day, you realize that staying calm isn't about being serene. It's about the survival and about the protecting the people in front of you. Our patients are already terrified. If we lose our balance, they lose their too. So the calm tune isn't because things are okay. It's because they are not, and someone in the room has to stay steady. This is the doctor, and maybe medicine teach us that no matter where we are from.
Thank you very much, Amani. It's a great way to end the session. I want to thank both of you again for taking the time to share with us your impressions and doing it in the manner that you have. I think it's been incredibly informative for all of us. And I don't want to keep you any longer from being able to have your iftar this evening. And we'll look forward to organizing a future session. Hopefully, once the National Committee is on the ground, then we can talk about some of the relationships that are being established between civil society organizations like UFDA and this new technocratic committee that will be on the ground. Have a great weekend, everyone, and let's hope and pray that the situation in Gaza improves quickly.
Thanks, Larry, and thanks for everyone.
Thank you, Larry, and thank you, Robert.